Now let's take a look at pulmonary emboli. So an embolism is a clot that has traveled and has lodged somewhere. So in this case, we have pulmonary capillary here and alveoli here, and we're coming from the right ventricle. So it's deoxygenated blood coming from the right side of the heart and coming through the pulmonary trunk, pulmonary arteries, pulmonary arterioles, and now we have a pulmonary capillary. So we're getting narrow, narrow, narrow. Well, because of some sort of coagulopathy or possibly atrial fibrillation, remember the atria, the top two chambers of the heart, when they quiver, the blood tends to flow slowly through the atria. And when blood slows down, it tends to clot. So if we have a clot that forms in the right atrium, it will get pumped to the right ventricle, and then will get pumped out through the pulmonary trunk and end up lodged somewhere where it gets narrow. So in this case, a clot formed in the right atrium and has lodged here. Well, now, the patient is breathing just fine. So oxygen is able to make it down here to the alveolar space, and but unfortunately, this clot is preventing carbon dioxide-rich blood from coming by the alveoli and dropping off CO2 and picking up oxygen. So there is no blood flow distal from this clot. So we can't get rid of the CO2, and there's no reason for the oxygen to hop into the bloodstream because there's no blood flow here. And originally the oxygen well that's in a high concentration here will diffuse into the bloodstream, but it will quickly reach equilibrium. And now we're in dynamic equilibrium. There's no reason for any more oxygen to diffuse in. So that's a pulmonary embolism. Treatment for pulmonary embolism or pulmonary emboli, if there are multiple ones, starts off with oxygen, and we're going to need to get rid of that clot. So something along the lines of heparinizing the patient or busting this clot is appropriate.